Hi, everyone. Welcome to the webinar on bringing a gender perspective into shock-responsive social protection. This webinar is organized by the Food and Agriculture Organization of the United Nations and the International Policy Center for Inclusive Growth. Next. Today, you will hear from Rebecca Holmes, who is the Senior Gender Fellow at the Overseas Development Institute, Maria Libertad Domitita, Gender and Humanitarian Response Personnel with Oxfam, and Julie Lawson McDowell, Social Protection, Cash, and Resilience Advisor, also with Oxfam. I am Liz Keshlein. I'm a Policy Officer at the Food and Agriculture Organization of the UN. Next. Throughout the presentation, you can submit questions to the presenters through the chat bar. Following the presentations, I will select some of these questions for the presenters to respond to. Due to time limitation, we may not be able to answer all of your questions, but these will be addressed through the online platform at socialprotection.org. Please also feel free to discuss today's webinar and topic on Facebook and Twitter. Next. Before we begin, I will give you some additional background on our presenters. As I mentioned already, I'm Liz Keshlein. I'm a policy officer working at the Food and Agriculture Organization in Rome, and I will be the moderator today. Next. The first presenter we will hear from is Rebecca Holmes. Rebecca is a Senior Research Fellow in the Social Protection and Social Policy Program at the Overseas Development Institute in the UK. She has over 10 years of experience in research and policy focused on the analysis of social protection policy and programming, with a particular focus on social inclusion and gender. Rebecca recently led work in Nepal and Malawi on addressing options for establishing more shock-sensitive social protection systems. Rebecca has published widely for a range of audiences on social protection and is co-author of the book Gender and Social Protection in the Developing World, Beyond Mothers and Safety Nets. Next. Maria Libertad has been a part of Oxfam International's humanitarian support personnel since 2017. As a gender advisor, she has been deployed in South Sudan, Kenya, Nigeria, and Somaliland to provide gender surge capacity, transfer knowledge and skills to national and local staff, and support gender mainstreaming in water, sanitation and hygiene, emergency food security, and vulnerable livelihoods and protection. Prior to that, she was Disaster Risk Reduction and Response Program Coordinator for the Philippines. She has dedicated the past 20 years to contribute to gender equality and women's empowerment in different sectors like reproductive health, community development, disaster response and preparedness, and more. Her work experience comprises humanitarian as well as development settings. Next. Our third presenter is Julie Lawson McDowell. Julie works within some of the most effective recent programming responses to extreme poverty and gender inequality, social protection and linkages, cash-based interventions in humanitarian contexts, financial inclusion, and women's empowerment programming. She draws on strong academic training and extensive field-based research to ground her analysis of poverty for appropriate programming policy and evaluation. Julie has worked at the national level in policy formulation, programming, operations, and evaluation in social protection and gender in Zambia, Kenya, and Somalia, and regionally in Southern and Eastern Africa. She has undertaken research and delivered capacity building for social protection and/or gender and livelihoods research at subnational level with teams in Pakistan, Zambia, Malawi, Somalia, and on financial inclusion in West Africa and Ethiopia. Julie is currently Oxfam's Global Advisor on Social Protection, Cash, and Resilience, sitting in the Global Humanitarian Team's Cash team. Next. So to get started, this webinar addresses a crucial dimension of an increasingly important topic: how to bring gender perspectives into shock-responsive social protection. When building resilience to shocks and crises through shock-responsive social protection or through social protection programming and humanitarian response, it's imperative that we recognize the role that gender plays in resilience and vulnerability, and that we design, implement, and monitor programming accordingly. Yet this remains a substantial gap. Next. Today, we're going to start a conversation on how to better integrate gender dimensions into social protection for resilience by addressing 4 questions. What are the differences in exposure and experience of crisis-related risks between women and men, and the differences in the roles and strategies that they adopt to cope with emergencies? What is the state of the evidence on the impacts of social protection on gender dynamics and women and men's socio-economic welfare in crises and disasters? What lessons can humanitarian and development actors share for ensuring that gender is well integrated in shock-responsive social protection programming? And finally, how can shock-responsive social protection systems be gender-sensitive or even gender transformative? To address these, Rebecca will introduce her ongoing analytical work on gender and shock-sensitive social protection, providing a conceptual framework for considering gender as social protection systems scale up in response to crises. Maria Libertad Domitita will discuss her experiences in integrating gender into Oxfam's cash transfer programming following Typhoon Haiyan in the Philippines. And finally, Julie Lawson McDowell will present on key findings from a gender analysis of a food and agriculture organization Cash for Work program that took place in Somalia, and how the findings were incorporated into subsequent program design to make it more gender sensitive. Before we start with the presentations, I'm going to walk us through a couple of background slides. So next. Social protection are the set of policies and programs aimed at preventing or protecting people against poverty, vulnerability, and social exclusion throughout their lives, with an emphasis on the poor and vulnerable. Evidence shows us that social protection is a critical strategy for poverty reduction, resilience, sustainable agriculture, and rural development. Among its other functions, social protection is designed to respond to shocks across the life course. These are also called idiosyncratic shocks, such as unemployment, the death of a breadwinner, or the birth of a child. Beyond this, there's an increasing recognition that social protection can contribute to disaster risk reduction and humanitarian response in the context of covariate shocks. These are the shocks that impact a large group of people at once, such as an earthquake, a drought, or a violent conflict. This recognition is evident in work that's been going on for over a decade on adaptive social protection to build resilience to climate-related shocks, as well as in social protection programming for longer-term resilience built into humanitarian response. More recently, we see an interest in building covariate shock responsiveness into national social protection systems. This is often called shock-responsive social protection. These systems may reduce the need for additional humanitarian intervention in emergencies by scaling up or modifying programming. Next. Unfortunately, gender issues receive relatively little attention in social protection programming, even in development contexts, despite the evidence of positive outcomes in terms of gender equality and the empowerment of women and girls. Evidence suggests that by making women transfer recipients, social protection programs directly reduce gender gaps in access to health, food, and education, and enables women's accumulation of productive resources and assets. Transfers boost rural women's influence in household decision-making and participation in social networks with positive spillover effects on food production and nutrition. The Food and Agriculture Organization will soon be publishing a set of 3 technical guides on how to integrate gender into social protection programming. These guides focus specifically on cash transfers and public works programs in a development context. I encourage you all to look for these when they come out this year. Next. So to bring these 2 ideas together, social protection can enhance resilience to covariate shocks, and designing social protection with gender in mind can lead to positive outcomes in terms of gender equality and women's empowerment with spillover effects. So then what about gender in crisis? Evidence tells us that women's and men's exposure to covariate shocks and strategies to cope with these shocks vary based on different roles and responsibilities in their household economies and differences in the capacity to manage risks. Women tend to be more vulnerable to certain kinds of crises because they face discrimination and unequal access to assets, productive resources and services, markets, technology, and education. Understanding how men, women, boys, and girls are affected by crises and integrating gender-sensitive perspectives into programming is critical for sustainable and effective interventions, as is also understanding how resilience and vulnerability are impacted by age, socioeconomic status, race, ethnicity, and many other factors that govern the expectations, obligations, opportunities, and constraints of individuals in society. Next. These are the references for my previous slides. Please note the forthcoming FAO technical guides. I encourage you all to take a look if you're interested. These will be coming out soon. Next. As I pass over to the panelists, I remind you to submit your questions throughout the presentations in the chat box, and I will do my best to address your questions to the appropriate panelist. Again, please join the discussions in the online community for gender-sensitive social protection at socialprotection.org. We'd love to have you there. And any questions that aren't addressed in today's webinar live will be addressed in the online community. Thank you very much. Now, next, I will pass over to Rebecca Holmes.
Great, thank you very much, Elizabeth. Well, it's very good to be here today to be talking a bit about how to promote and the issues around promoting gender equality and women's empowerment in shock responsive social protection. As Elizabeth mentioned, there has been increasing attention to using social protection in emergency contexts over the last few years. And we've seen a lot of innovative programming, implementation and financing mechanisms, which has helped social protection to adapt in response to crisis, but also thinking about preparing for shocks in advance of crises as well. At the same time, over the last 10 to 15 years, there has been increased attention to addressing gender equality, inequality, and promoting women's empowerment in social protection. Of course, there is still a long way to go, but I think it's also good to recognise how much we have advanced in terms of thinking about programming and implementation. At the same time, there's also been increased recognition of the differential impacts and risks and vulnerability that men and women face in crises, and humanitarian approaches have been responding to that too. But I think where we're at the moment is that there's few lessons being learned between the two sectors, and really then thinking about what that means for shock sensitive or shock responsive social protection. Next slide, please. So in this presentation today, I'm going to spend a bit of time just very briefly actually talking about why it's important to integrate gender into shock responsive social protection, but then talking a bit about the importance of getting gender right in social protection programming in normal or in developing contexts. And then I'm going to talk a bit about some considerations and implications of addressing gender in shock responsive social protection planning, design and implementation, and some thoughts about moving forward. So these kind of thoughts and considerations, thinking about the approach for gender into shock responsive social protection, has been based on literature review and reading and my own experiences around both in humanitarian spheres, but in terms of delivering social protection type tools in humanitarian interventions, but also in developing social protection and integrating gender into social protection in normal times. If I could have the next slide, please. In terms of why it is important to integrate gender into shock responsive social protection, which is on the next slide, please. There are a number of reasons, obviously, and I'm not going to go into too much detail on this, but I think there are just a few key points worth illustrating. So one is that if you get gender right during normal times for the core objectives of social protection to reduce poverty and vulnerability, if you get gender right, you are reducing poverty and vulnerability for women as well, for women and for men and for their families. but also critically, social protection has a role to build resilience, and paying attention to gender can specifically build women's resilience and coping strategies in the event of a crisis. We also know that obviously these gender inequalities exist before a crisis, so addressing gender at that point is particularly important. But gender inequalities are also often exacerbated in a crisis, which makes it even more important in a shock responsive context to design and implement social protection that actually preserves those gains that have been made in terms of promoting gender equality and empowerment. Next slide, please. Additionally, if a gendered social protection approach already exists in normal times, then adapting that program in terms of thinking about adaptation of design and implementation to deliver it in times of emergencies, it will already have the core foundations of gender issues in that. And then finally, I think there's an assumption that gender equality and promoting women's empowerment should become a secondary objective in times of crisis. But we know that that's not the case, and that also emergencies may offer an opportunity to reverse pre-existing gender inequalities. And it doesn't take much, to some extent, to make tweaks in gender in social protection programming and design to really promote gender equality outcomes, and they should be considered in a shock responsive approach. Next slide, please. So just one slide on getting gender right into the foundations of social protection policy and programming. In terms of social protection achieving its core objectives of reducing poverty and vulnerability. So we know that careful attention to gender equality in terms of design and implementation can actually promote a wide range of positive outcomes. For example, improving women's access to and control over income and assets, enabling equitable access to basic services, especially around specific points in education and enrolling girls, also promoting better access and improved access to health and also reproductive health services. But it also can increase confidence, bargaining power, and women's status as well. And we know that there are some relatively simple design features and implementation features that can really contribute to these outcomes. And they include considering gender appropriate work and equal wages, flexible working hours and work opportunities close to home for public works programs, for example, providing good quality childcare options, considering the time that it takes for women in particular to collect cash transfers, for example. And these are all issues which, if a gendered vulnerability, poverty and vulnerability assessment is taken in the first place to design a social protection, can highlight what these features are to ensure that women have equal access to and equitable outcomes from social protection programming. We also know that if you pay specific attention to gender equality and women's empowerment, that more transformative outcomes can also be achieved. And we are seeing through emerging evidence that outcomes on a more transformative scale for women include delaying marriage and pregnancy in adolescent girls, increasing economic security and emotional well-being for women, reducing gender-based violence, increasing women's decision-making, supporting changes in the unequal division of labour in the home between men and women. And these are all really important outcomes for women which can be achieved if particular attention is given to social protection design and implementation. And these include setting out empowerment objectives at the front of the programme. They can also be achieved through positive messaging through the programme, through complementary programmes and services, and including men and boys, but also the participation of women as well in programme design. If I could have the next slide, please. So thinking particularly to the features of shock responsive social protection. So there are a wide range of experiences in terms of exploring or options for delivering social protection in terms of crisis. And I just wanted to pick up on a few of those. So around the planning and preparedness in advance of crisis, adapting social protection design, considerations in implementing social protection in emergencies, and also around systems and monitoring and evaluation. If I could have the next slide, please, which starts looking at particularly around planning and preparedness. So we know that a key aspect of social protection programming in response to crisis is to be better prepared in advance of a shock happening. Either a combination of planning and preparedness in advance, but also designing interventions which can build resilience and offer coping or alternative coping strategies to women and men in times of a crisis. And some of the key implications specifically around preparedness activities are really to understand what are the different needs and vulnerabilities and effects of a crisis on women and men. And data and statistics and evidence is absolutely critical to ensuring that programs can be designed in advance, but also that planning for this takes into consideration the differential experiences between men and women in times of a crisis. And there are real opportunities here, especially between what data social protection programs can collect through, for example, a gendered poverty and vulnerability analysis, understanding the impacts of social protection programs on gender relations, and how that could be used by humanitarian actors, for example, in designing humanitarian interventions. But also thinking about the needs of social protection actors in designing shock responsive social protection programs, and how they could use existing data and analysis, for example, on rapid response assessments, which the humanitarian actors collect. So there's a real opportunity here for sharing and coordinating existing information on the needs of men and women in the context of a crisis. The other issue as well is around designing interventions which build resilience and in advance of a crisis, which is also absolutely critical. And I know that a couple of my colleagues are going to be talking about this in a bit more detail in the next couple of slides. But I think just to highlight at this point that women and men experience different levels of vulnerability to the same shocks. They often have fewer coping strategies available at their disposal, which can undermine their resilience to coping with shocks. For example, having less access to protective assets and resources, different social capital networks to rely on in times of need. And also women may be less able to seek safety and access emergency response programs. And all these issues require consideration for when you're developing a shock responsive social protection approach. If I could have the next slide, please. So we know that there are lots of different ways in which social protection is currently being adapted to respond to needs. There's a recent study led by OPM, which ODI contributed to, which outlined a conceptual framework for understanding the different types of response. And some of you might be familiar with these, which include piggybacking, horizontal and vertical expansion, design tweaks, etc. And I just wanted to pick up on a couple of these adaptive programs and consider what implications these have from a gender lens. So the first is around horizontal expansion, which is adding a new caseload to an existing social protection program temporarily to increase coverage in response to a covariate shock. And here issues of targeting come to the very forefront of the discussion, specifically because the program is adding new beneficiaries. Now, when thinking about the existing available evidence from existing studies from both humanitarian and developing contexts does show a number of implications for thinking about targeting women in this context. So one of them is that I think care must be really taken to ensure that women are able to access these schemes, and that some of the economic but also social barriers to accessing both emergency response but also social protection programs are taken into consideration and explicitly discussed and find ways to overcome some of those potential challenges to ensuring that women have equal access to shock responsive social protection. Another issue is the importance of sensitizing community and households to different targeting mechanisms. And I think this is especially important when a program targets women as the main beneficiaries. We know that in both emergency and developing contexts, that there is a need for discussion at the community but the household level as to the reasons why women are being targeted. And this can then ensure that there are no negative repercussions of women being targeted for these programs. Another consideration when adapting the targeting criteria is to ensure that when you're taking on a new caseload of people, that the existing program design is appropriate for that context. So obviously in the context of emergencies, situations change, economic opportunities, social vulnerabilities also increase. And it's important to consider, especially from a gender lens, especially if there are particularly vulnerable groups of women, elderly, pregnant, for example, that the social protection design matches and is appropriate to the new target group. If I could have the next slide, please. So moving on to issues around vertical expansion. And this is the temporary increase of a transfer value, often to existing social protection beneficiaries in the context of a crisis. And there are a number of ways in which this is calculated, for example, in terms of a food crisis, to match it to the food basket, for example, or increasing the proportion of household consumption or expenditure that a social protection program can meet. In developing contexts in normal times, on the one hand, the evidence does show that increased value of transfers can have bigger effects. For example, in terms of enhancing savings or productive investments, it's also been used to increase girls' enrollment, particularly at particular times of their schooling, such as secondary school. But there are also concerns that a higher value of transfers might also have a negative impact on intra-household relations. So what we find is that evidence suggests that smaller transfers targeted to women that don't really affect the status quo, don't threaten existing, relations within the household, are normally, sort of okay. But in terms of emergency contexts, then intra-household tensions might be heightened, and if you're increasing the value, then those issues need to be taken into consideration. And there are ways of mitigating the potentially negative effect of these of programs. For example, ensuring that you conduct a risk assessment in advance of targeting, also understanding what the existing issues are in terms of intra-household relations, engaging men and boys into the program design and implementation. There's also consideration of how to integrate empowerment objectives, and linking this to the point I previously made about not relegating gender equality and empowerment objectives in social protection, especially in times of crisis. But there is a need for us to think more positively and more strategically about what are the options for promoting women's empowerment objectives, even in the context of crisis. And there's little evidence on this at the moment in humanitarian interventions, and there's emerging evidence in social protection development contexts. But as I mentioned earlier, there are potentials such as the use of strong messaging, for example, but thinking about how this could be adapted in times of a crisis. Could it be an effective tool to positively influence gender outcomes, especially thinking about heightened risks to violence, for example, still using these messages to promote positive gender outcomes in terms of promoting joint decision making, for example. There also might be opportunities to link transfers to economic training, to vocational training, There also might be options for linking social protection programme beneficiaries to access to protection services or particular programmes and services that women need in the context of crisis, such as health and reproductive services, for example. If I could have the next slide, please. So, in terms of implementing social protection in times of crisis, there are also a number of implications which need to be considered here. One of the main ones is around staff capacity. So again, we know from both the development context but also humanitarian context that staff skills and knowledge on gender programming is absolutely key to implementing gendered interventions. But what we often find is that either it's not made clear about the gender objectives and how these can be implemented in social protection programs, or that they're lost between program design and program implementation. But actually, staff training on gender is absolutely critical in both sectors and thinking about shock responsive social protection, especially if new staff are being brought in to help deliver a social protection programme in the context of crisis through an increased need for capacity for delivering a programme. There's also been recent innovations in technology which can potentially provide important opportunities and progress in terms of gender outcomes. So receiving cash via SMS or other forms of e-payment, for example, in humanitarian contexts, have been seen to improve women's safety and timely access to transfers. Whilst on the one hand there might be concerns, especially around women who perhaps have lower literacy rates to using technologies, these can also be overcome with training and awareness on these technologies to use, and I think they can offer a potential opportunity here. Other considerations are around the participation of beneficiaries at all stages of preparedness and programming. We know that women face difficulties and challenges in terms of accessing decision-making spheres, in terms of being involved in program governance and program participation. And so these need to be paid attention to, particularly in shock responsive social protection too. There's also an issue of identifying in coordination with local women's organisations and or collective action groups working at the very local level. And these are absolutely critical in promoting gender equality, in ensuring a gender sensitive approach. There are a few exceptions, but overall they haven't, women's organisations, groups haven't been vocal in social protection programming in a number of countries. And then underpinning all of these issues are, of course, systems and monitoring and evaluation. Some social protection programs have got better, have improved at collecting sex and age disaggregated data, but a lot of monitoring and evaluation still doesn't happen at the individual level. It only happens at the household level. And also, there's an absolute critical need to ensure that these statistics are analysed from a gender perspective. It's not sufficient to just disaggregate by sex and age, but a gender analysis has to be implemented. So if I could have the final slide, please. So in terms of moving forward, there are obviously multiple ways in and issues that need to be addressed, but I just wanted to flag three things here, and it would be great to maybe have this as a to receive comments and perspective on these as well. So the first is around the establishment of minimum standards in shock responsive social protection programming. At the moment, it's integrating gender into social protection in developing context is ad hoc. It depends very much on the program. But if we were to establish minimum standards in shock sensitive social protection that included particular aspects around ensuring a poverty and vulnerability assessment in terms of staff capacity, objectives for gender equality, then that could help move us forward, not only in the developing context, but also in terms of shock responsive social protection. And there is a particular issue here around ensuring that interventions, especially in humanitarian crises, do no harm for women. The second is around changing the narrative on gender to one which promotes women's voice, agency and empowerment. You know, both the social protection sector and the humanitarian sector have seen important gains in promoting gender equality, in starting to think strategically about how interventions can promote women's empowerment. But it still is often treated as a secondary objective, or these programme objectives are lost within programme implementation. And so I think it really does require a shift in narrative, and it requires setting objectives for women's empowerment at the forefront of social protection programming. And it also requires investing in the necessary finances and capacity to ensure that these issues are at the forefront and are invested in and implemented. And then finally, the final point is around investing in women's organisations and supporting collective action across both the humanitarian and social protection sectors. So this is also an area which I just mentioned has not received so much attention, but is absolutely critical to ensuring that we move forward and that we get together a broader coalition of actors which are advancing gender equality into shock responsive social protection. So that's it from me. Be happy to discuss any of these points later in the discussion, and I'll hand back over to Elizabeth. Thank you.
Hi. Can you hear me? Okay. Hello, everyone. Thank you for attending this webinar. So I'm happy to be here and share my experiences and my own reflections about this topic. So we're talking now about a gender responsive and shock responsive social protection in a humanitarian setting or in a humanitarian response. Next. My basic premise is any social protection program and any humanitarian response cannot be shock responsive unless it is gender responsive. Next. So let me share this framework. I will not comprehensively explain these things, but just to help us analyze or think of how to connect different concepts as we design a particular humanitarian program or implement activities. So this is called the gender crunch model, and I'm sure those who are in the DRR sector here are very familiar with this, the crunch model per se, but this one is the gendered version, and this illustrates the progression of vulnerability. It provides an explanation for the interrelationship between the different elements that cause vulnerability. So if you see the three colors here, the yellow, the orange, and the purple, they represent different social processes that cause vulnerability. The root causes, that's the purple one, dynamic pressure, the orange, and then the unsafe conditions. So the root causes lead to dynamic pressures, and that explain how the unsafe conditions have risen and persisted. And please note that I consider hazard to include natural and human-made here. So when disaster strikes, the unsafe conditions are the ones which are magnified and which are obvious to us. especially for the humanitarian, in the humanitarian sector. That's what we see when a crisis happens. The human sufferings because of these unsafe conditions are very, very, very visible. So we come in and respond to the disaster risk. Next. So we focus our efforts on life savings, which is extremely important, but we should not discount the fact that the unsafe conditions and the underlying layers are pre-existing in most cases, if not in all cases. So with a gender lens, we see that the progression of vulnerability differs between women and men, girls and boys. As mentioned, understanding the gender dimension of crisis is very critical. As women and men, they experience different exposure to hazards and risks and are impacted differently and employ a diverse set of coping strategies due to their social roles and different capabilities. So when we do respond, trying to make them safe, we have to customize what we do because the people we want to help are of different genders and with different crises, and therefore different impact. But then let's also remember that in many cases, the chaos of a crisis offer also some silver lining. It offers opportunities to unpack those underlying layers, to expose them, and to respond to them as well, not just the unsafe conditions. So when we design our humanitarian response, we must take advantage of these opportunities and facilitate interventions that will contribute to the resilience of the vulnerable. Next slide, please. Okay. The next slide is just to emphasize, and I think this is also very critical in social protection, on how we looked at risks. They're not equal, no? They're not equal because the people experiencing the risk are of different vulnerabilities. And I just picked up these points actually from, this is a quotation or an extract from the quotation from a foreword in one publication. It's an Oxfam's briefing paper entitled No Accident. And this was outlined by Her Excellency Ellen Johnson Sirleaf, of the previous president of Liberia. So as mentioned, risk is increasing dramatically. It's reducing vulnerability can only be done through addressing inequality of power. Wealth is increasing, but so is inequality, and many people are being completely left behind. Inequality makes it so much harder for poor people to work their way out of poverty and risk. In some cases, risk is even dumped on poor people. In general, we have seen examples, and there's researches around it and we know this is a very exciting topic, where rich countries are fuel climate change, and then it's the poor countries who suffer these consequences. Big businesses makes profit without care for people displaced or disrupted. Governments support economic growth without also supporting social justice and sustainability. And property laws and unjust care systems means that women cannot fulfill their full potential. So many risks are dumped on poor people, and women face an overwhelming burden. Next. So in the next few slides, I will share my own reflection based on my own experiences, which I have taken from the Philippines during and after Typhoon Haiyan, and also other typhoon responses in the country. So I want to link social protection and gender programming in humanitarian settings, and I have 3 points that I would want to emphasize. First is that cash transfer can address gender inequality. Second, organizing and capacitating women is a very important point, a very important intervention, which should be taken both as a means and an end. And the last one is looking at institutions and addressing institutional barriers. Next. Next, please. So let's look at the first point. Cash transfers that addresses gender inequality. the first in the Philippines, cash transfer programs in humanitarian setting has been implemented, and it was a huge program during the Typhoon Haiyan response. So we do a lot of cash for work, and we had this issue during the Typhoon Haiyan when right after the typhoon, obviously there was so much debris around. There's a lot of areas that needs literally cleaning, lots of coconut trees just lying everywhere, and so many other kinds of debris. And one of the major programs or major activity during the Cash for Work is really clearing the roads, clearing community lands, removing all this trash around, the huge coconut lumbers and logs. And then part of the program is to not just the Cash for Work itself, but provide like instruments like chainsaw and those things. So with the design of the program, it became so obvious that the beneficiary, when we target the beneficiaries for this, then we are actually targeting men, because when we designed the programs and the kind of activity that was made available was more catered to or designed for men. So it was a discussion in our end when we were thinking of, okay, how do we expand women beneficiaries in this kind of programming? So when we sat down, our own food security and livelihood team, the staff, the local staff, we tried to lay down, okay, what do people do? How do we clean the area? Blah, blah, blah. So really like step 1, step 2, step 3 up to the last end. And then we said, okay, so this is not just about using a chainsaw and cutting a tree and then carrying heavy loads. So when we identified small activities, different activities, including picking up small debris, cleaning, like sweeping, etc., then we said, actually, we can have 50% women and 50% men, because the kind of activities can be divided into work of women and men. So that's an example when we say, using the gender lens, that we can target women in and initially designed programs which catered more to men. The second example is the cash for care work. The discussion on care work is still, I think, a very new concept, even for humanitarian setting, and I think in general, even in the development programs, because the recognition or the meaning of work also is determined by our own stereotypes of what a person does, what a man do, what women do in that particular setting. And then usually when we have to pay for work, the care work or the domestic work, these are not visible, these are invisible, these are not paid, these are unpaid. We don't put value into it. So during the Typhoon Haiyan, this is just a discussion. We tried to accommodate in some examples, but this was not systematically part of the design. But later, just right after Typhoon Haiyan, there was less than a year, I think, there was another typhoon, the Typhoon Ruby. So we really put it into a systematic and say, okay, when we do design cash for work, let's explain that we can actually also include care work as part of the activities. So that means expanding the meaning of work, putting value to care or domestic work in that setting. And when we do that, we try to explain why. This is a challenge. When there was another typhoon, that's the Typhoon Haima, it was more, it's an expanded program, still small scale, but expanded compared to previous humanitarian response we did. We really said, okay, set aside particular budget for cash for care work, like really label it. One of the major challenges during the time is among the staff, among our own local partners, and among the beneficiaries themselves. There is this mindset that why would you pay something that women actually just do freely? Why would you recognize that cooking in the house, for example, or cooking for domestic purposes should be paid and should be part of the care work? So therefore, one lesson for that is, okay, maybe from our side, we see this as a gender issue. They may see it as a gender issue, but they need to have, we should have more education, more information regarding this matter. So recognizing that a work from being unpaid can be paid, that a work which is considered without value has actually value, and as humanitarian workers having a cash transfer program, we can put value to that, and that can be demonstrated in a very systematic cash for care work program. As an example to demonstrate it is between two vulnerable women, for example, in a community, both affected by crisis, the same shock. The first person would have more younger children, have family members who are sick at home, while the other may not have. So both vulnerable, both affected, but the one with a higher level or high responsibilities in terms of care work, we can consider them more vulnerable because they might have mobility issue in the sense that they cannot leave the house because they have to take care of a lot of people. There could be livelihood activities, food security activities, or any other aid activities which would require them to participate. It's available, they can access it, but because of that responsibility inside the house, then they will not grab that responsibility. So that's why looking at care work as an important aspect, as an important dimension during a crisis, during a humanitarian crisis, is a very, very important thing to consider. And the last one is the care or the cash for assets. The cash for assets is something that we also do in most of the type humanitarian responses in the Philippines, where it's an example of a conditional cash transfer program in a humanitarian response. But then most of the time, because we talk about productive assets, usually the initial assessment or the initial perspective is that productive assets would include assets mainly used by men. So if you are talking to beneficiaries from the fishing communities, fisher folks, then when they list down assets that they need, that would include boats. So then we have to sit down and again and say, okay, if it's boat, then therefore it would only include men because they are the one using the boats. They're the one going to the open ocean using the boat for fishing. So when we do analyze fishing activities, we say not all fishing activities are actually in the middle of the ocean, in the open sea. So we listed down, okay, a lot of activities like nearshore activities. There are small kinds of fishing nets. There are small kinds of activities like picking shells. Even once the men come back to the shore, all the different activities, it's women who's in charge, up to the selling of fish in most of the Philippine coastal communities. So then what assets do they require? They don't need boats, but what do they need? They need small types of fishing nets. They need big basin. They need cleaning materials. They need things that they can use so that they can sell the fish. So then we have to consider those as assets as well, and should be part of the cash for assets program. And when we also try to analyze what are the different activities, economic activities that women do in a particular community. For example, there are women who do laundry services for their neighbors. There are women who cook and sell cooked meals, snacks in the community. And they do have assets that require assets. If they are cooking something, they need bigger pots. They were lost during the typhoon, they don't have that. But most of the time, they're not included in the definition of assets in a cash for asset program. So those are 3 examples where when we use gender lens, we can do cash transfer that are more inclusive and more empowering to women. Next slide, please. So the second point is about organizing and capacitating women. My fellow presenter has explained this very well when we say that the gender equality objective becomes a secondary objective. The sectoral goals is obviously a primary goal, So when we have a WASH program, so we have WASH as a sector and we have sectoral goals for that. For example, public health. No? We want waterborne diseases to be mitigated, which is fine. But then when we do gender mainstreaming and WASH, what often happens is that women are included, which is a good thing, and they would definitely appreciate, and there would be some gains and outcomes by having women increase their participation in the WASH program. But what I am mostly sad is when we just limit ourselves up to that, because otherwise what we do is we actually use women for aid efficiency. We want women to be part of our program because women tend to work better when it involves water, because women use water. So when we include them, then we are actually reaching for obtaining or achieving the sectoral goals in WASH, as an example. So women's inclusion and participation and gender equality becomes a secondary goal. So what I am often advocating is for us to go beyond that and say that it can be taken as an end itself. And therefore, other than having them as part of the program, we have to organize them and capacitate them, not just to deliver our own program in whatever sector, but having them together as a way or as an opportunity to set up their own platform, to set up their own spaces so that they can talk to each other, so that they can talk about their problems, they can have safe spaces, they can motivate each other, they can come together for coming together purposes, not just because they will deliver something for a particular agency, for a particular sectoral goal. So we need to add interventions that really enhance women's agency, or not just women, but any other vulnerable groups identified. That will help facilitate self-determination, and that will help them set their own agenda. So let their coming together be their own platform for their own empowerment. That is a durable solution. That is helping them increases their social capital. I remember one example. This is after a big tsunami in Sri Lanka, when there is in that community there were already existing women's groups. These are self-help groups, federated already, very strong. So there was this huge livelihood program, and the donor or the humanitarian aid agency offered sewing machines, like really good sewing machines, and they are, it was a lot of money. And then when they gave it to the women's groups said, no, why are you giving us sewing machines? We don't need them. What we need is this one. So they submitted their own list. Like practically they did not accept the sewing machines. So that is setting their own agenda. And that's a lesson for us humanitarians, that, hey, we cannot just really dictate based on what we think they need. But that kind of negotiation and bargaining power does not easily happen when women are not organized and are not capacitated. And then the last point is that women should be considered as responders. They are not just beneficiaries, they are not just affected. Before even us, any humanitarian agency, reach the communities, women are already responding. They are the one taking care of the sick. They are the one taking care of the needy. They know the needs, etc., etc. And in fact, when they come in and start our own assessment, we chase them as our own respondents because they know a lot and they have done already. So that is changing, as my other presenter said, that is change in the narrative, and including social and feminist movements in that particular community. This is a challenge especially for big emergencies. When you come to a community and you want to have partners, you don't know them, or maybe there are no formal groups, but in most of my experience, in most communities, formal or informal, there are different setups and social groups which are which are coming together for a particular purpose, and we have to work with them. As a note for this, I have been focusing a lot on women, but let me also say that there's a need to engage with men to secure their involvement in changing gender harmful norms, and so that they can be our partners, they can advocate against discrimination, against any harmful practices, as well as structures that drive inequality between women and men, girls and boys. Next slide. Okay, the last one is addressing institutional barriers. So when a disaster happens, this usually happens in a setting, in a community where institutions are weak. And Philippines, as an example, probably is better than like a fragile state. So if we go to a community where institutions are actually existing, functioning, then we have to understand what works and what doesn't work. And if there are programs and services and benefits that the affected communities, affected women and men, girls and boys can actually access, we have to play the role of bridging them to these available institutions. So we have to look at governance, what are the policies, are there in place, DRR mechanisms, gender development mechanisms. When we talk about financial access to financial institutions, so that's on the side of financial inclusion. Is this an area where would women, for example, be able to access credit because there's a disaster, they need capital, they need any money for a particular purpose, but they are not banks. But there could be existing microfinance institutions. And if there are, can we link them? Can we use our humanitarian program to link them? In the Philippines, we have we had projects where we had to talk to even up to the central bank, giving assurance and bridging our beneficiaries to them and say, okay, these groups were affected by this typhoon. They cannot comply with the usual formal requirements of a bank. But what we want to do is we have this cash for them. We want to transfer cash for them. Can you include them? So this is a bridging. And then from there, it was built after the typhoon. Then there are more and more financial inclusions programming were done towards this recovery period and up to a more comprehensive development programming on financial inclusions. Technology is something that we can fully utilize. We have lots of examples in humanitarian responses where mobile phones are used to transfer money, remittance center, etc. So we have to look at them and use them for the advantage of our beneficiaries. So we have to link the beneficiaries to the pre-existing social protection programs in the country. So in the Philippines, one of 4 examples that we have the 4-piece programs. There are already a lot of literature saying 4-piece is an anti-poverty program where the government has massive lists, pre-listing of the most vulnerable families, and we have to link with that list. And then the PhilHealth, that is health program, microinsurance, and then the crop insurance. So basically, those are the 3. And my conclusion is that the last slide is just to say that all these things can be very, very successful when they are integrated together. So the lesson is integration. They are potent if we do them together, multiple pronged integrated approach, and in the entire project cycle. Thank you so much.
Thank you, Libby. We'll now pass over to...
Hello, can you hear me? So I'm currently working for Oxfam, but I used to work for FAO, and I was involved in the Cash for Work program in Somalia from 2012 to 2014. And this presentation is giving us an example of how we tried to integrate gender from safety nets to resilience, and to understand how gender shaped risk and vulnerability in a protracted and recurrent crisis. The case study dates back to June 2013 and is from Dolo, Somalia. And I undertook this research with Michael Oyat and Ashabir Bekele from FAO Somalia and a large local national team. Next, please. So why is this case study relevant? This, I think, is an early example of a humanitarian safety net, the Cash for Work program, in a very difficult context, a fragile and conflict-affected area with famine, which over time evolved to joint agency resilience programming and an attempt to properly integrate gender. So the background was the 2011 food security crisis and famine in Somalia. FAO rapidly scaled up its Cash for Work program as a flagship response. The goals were a cash income to give a minimum food basket to eligible households, rehabilitation of community level infrastructure or construction in order to protect production and increase production, and to give communities an alternative source of employment and to reduce the crisis migration that caused so many deaths. This was donor funded, it was delivered through local partners, and for the most part, this program was remotely managed. Next, please. Next. Oh, here we go. So, after the initial response, as the crisis began to abate and we moved towards recovery, there was a strong focus on building community and household level resilience. And in quite an unusual step, FAO and UNICEF and WFP worked together to create a joint response, which they called the Joint Resilience Initiative. And this was quite an unusual move at the time and was difficult. And if we think back to the OPM shock responsive social protection strategy, we see that one of the first steps in a context without a functioning government, where most services or humanitarian support was being delivered through agencies, the UN agencies, as well as NGOs, the various consortia, sought to align their work better around communities and households. So this was done through moving towards an aligned strategy, through beginning to think about a common results framework, how we could understand what we were doing in different areas through a common framework, through common area-based planning of interventions. We were often working in the same parts of Somalia and Somaliland. We wanted to have improved joint information gathering, monitoring work and evaluation. We wanted to advocate together, to talk to the donors, to talk to the funders, to talk to government together. And we wanted better joint analytical work. And looking back, I think it's very clear that this was a critical first step towards perhaps not a shock responsive social protection system, but a safety net that could ultimately lead to a system. Next. So gender. Why did we start thinking about gender? Well, partly because of the people who were in place, but three triggers came in. In the Cash for Work program, we had reserved 30% of places for female-headed households or women who wanted to be involved. But it was clear from monitoring and feedback and talking to our partners that women were taking up complementary tasks. They were cooking or carrying soil or bringing water to the diggers, or they were substituting men if they had men available within their family. But we didn't understand the full implications of this. Was this women's choice? Was it some sort of cultural obligation? Who would receive the cash at the end of the day? And we wanted to understand better what was going on. The initial resilience baseline consultations just talked to the community. They didn't talk to women and men separately. And in a highly segregated society, such as Somalia, and in any society, I think, this was inappropriate. So we had a very, as FAO, and in partnership with UNICEF and WFP, we said, oh, this is not good. We need to do this better. And at FAO, we had in place a 6-month stock-taking exercise that had been undertaken by the Somalia Food Security and Nutrition Analysis Unit, looking at gender in emergency food security, livelihoods, and nutrition in Somalia. And this big study, it had brought together a lot of information for us on traditional gender roles in food security, livelihood, and nutrition, and also information about how the pressures of drought and migration and famine were shifting these gender roles, and that we weren't integrating these findings, this learning sufficiently in our work. So the alarm bells are ringing, and we decided to carry out, I called it a quick and dirty study, and that wasn't very well taken, but it was a rapid gender analysis of poverty, livelihoods, workloads, and institutions. Next, please. So the objectives of this quick study were to understand gender differences in livelihoods, the division of labour, and in time use, in participation in village-level institutions, and also to try and interrogate wealth differences and gradations of poverty as seen by men and women, and rich men, rich women, poor women. And the ultimate objective, of course, was to make sure that FAO programming and the broader joint agency resilience programming reached women as well as men, and that the poorest were included. Next, please. So the methodology was fairly straightforward. Sorry, you'll hear I've got a little scratch here. Except, of course, for the most part, this work was remotely managed because we were in fairly insecure areas. But we managed to cover 6 different villages around Dolo with different livelihood types: pastoralist, agropastoral, peri-urban, and riverine. And we carried out 5 different activities separately with male and female focus groups, and we had teams made up of men and women so that they could work with the male and female focus groups. So we had well-being ranking, we had seasonal calendars, we had daily activity clocks, which of course are a snapshot that particular season, that particular week. We had a 3R matrix, which looked at the use of natural resources. That was an FAO tool. And we used institutional mapping, Venn diagramming to look at institutions. Next, please. So the results focus quite a lot on workloads. And although it's hard sometimes to untangle what you might call the domestic and the productive division of labour, we had a go. So the first column, and we don't need to look in great detail, the first column describes what men and some boys were doing, and the second column is women and some girls, because of course in these large households with little access to education, girls and boys are brought very quickly into the workforce. So men in domestic terms were focused on the bigger animals, the camels and the cows, which is actually richer households. And there's a lot of, taking them out, giving them food, giving them water, bringing them in, shutting them up, making sure they're okay. Men also got involved in water collection, particularly when this involved quite a long journey. Sometimes this could be as far as 15 kilometers, a 30-kilometer round trip, and often donkey carts were used. Sometimes there were dangers at the riverside, such as crocodiles. Men milked the bigger animals, dawn and dusk. Men collected firewood, bigger firewood, more distant firewood, more remote firewood, and were involved in some house maintenance, from chopping down trees and other male tasks. Women and girls had a set of parallel activities which complemented the male activities, often focused on a different set of animals, on water that was closer by but where they would carry on their back, on firewood collection, again closer but carrying on your back. And then they had a set, if you look at the red box there, these are activities which are what women and girls do without much or any male support on a daily basis. So daily food collection, daily food preparation, cleaning, washing clothes, washing up, childcare, and house maintenance. And I'd also like to point out that women, because of the high rates of the large family sizes, most of these women were constantly they were either pregnant or they were lactating, and this adds a strong physical burden to daily work. Next, please. When we look at the so-called productive division, and you will see overlaps, we see that women are critically involved. They're not just housewives, they're not just staying home, cooking the food, washing clothes, that they are very active in all areas of production and marketing, and that the poorer the household, the more active everybody has to be just to survive. So again, I've divided it into men with boys, women with girls, and I've talked about livestock, farming, selling labor, marketing, and businesses. And without getting into the nitty-gritty, at each point, women have specific tasks, complementary tasks, although you could also say that men's tasks are complementary to women's tasks. I don't want to say women add on to men. And the poorer the household, the more important the home-based task, because the fewer the large animals. So we see livestock, farming, water catchments, selling labor, marketing, and businesses. Clear gender divisions about what type of thing men and women do, but equally important to the household. Next, please. So we did a snapshot of a men and women's working day in an agro-pastoral site. And the important thing here is that both men and women have got long, busy days. But on the right-hand side in red, we see that men get a little bit of a break during the day. Women's boxes tend to be fuller up. I mean, there are quite a lot of prayers, which I guess is a break, but otherwise women are pretty busy from morning to evening. Men seem to get a little bit more free time. So certainly when we're thinking about scheduling extra work for women, we need to look at their existing workload. Next, please. Yes, these are the conclusions. Unequal leisure, longer days. We see differences between men and women, richest and poorest. Men take socially sanctioned leisure. And when I say socially sanctioned, I mean that it's a norm. Men take a break, they go, they have tea, they have the BBC News, they have cat. We interrogated whether the poorest men join in, and it seems that a lot of the time they do. They're treated by better off men. They're still welcome for their conversation. Somebody gives them a little bit of tea or something. And they're often able to do this from sort of 4:30 in the afternoon until dinner time. There was general agreement, particularly amongst women, of course, that women have longer working days. They have repetitive domestic chores. You could qualify this by the fact that men often carry out physically very arduous work. The migration is very arduous when they do their own domestic tasks. Digging, felling trees, all that's very arduous. But then you could say again, well, women are bearing children and feeding children from their bodies, and this is also very arduous. When it came to poverty, the richest and the poorest are often the busiest. The rich have much land, if they're able to cultivate, and they have many animals to care for. At the same time, they probably also have large households and can share out the work. The poorest are scrabbling to survive. They have to look around all the time for different tasks that can help them survive. Next, please. A second area of results, which I thought was particularly interesting, is that men and women see in these 6 sites in Dolo, gave us different descriptions of poverty and coping strategies. Women identified more ultra poor, because we did the normal thing of rich, medium poor, ultra poor. We didn't find that in every village, but where we did find the ultra poor and the poor, women were more inclined to talk about the poor and the ultra poor and to describe them in ways that men didn't. So women talked about the ultra poor as being dependent. They only had what was given to them by better off households. These ultra-poor households also had very high levels of ill health. So they had very limited, they were limited in terms of the work they can do. They had to send their children away to better off relatives to reduce the number of mouths to feed. And there are some studies on what happens to children who are sent away, and it's not always a very positive story. They're often more domestic laborers than they are children sent to school. Women in the poor households and ultra-poor households were described as receiving critical support through loans of milking goats from other women, which I think was a very interesting insight into a coping strategy at a fairly low level. Goats from women to women, which are essential for those poor households to survive. And the numbers, as I said, the numbers were higher. Men seem to talk more about sort of more masculine aspects of poverty and how poorer men were marginalized in political terms within the village, and how in the pastoralist sites, they said, well, there are no ultra poor. They couldn't stay. They lost all their animals. They've had to leave. So we wondered whether perhaps men were shamed by the failure of the clan system to provide for members. And at the same time, we were interested to see the insights into other people's household level female coping strategies from women. Next, please. So a third area where we were very interested to know what women and men thought and whether this was different was around consultation from outside and institutions and community decision making. The villages we visited were very short of institutions. Our Venn diagrams were almost empty, around 4 per village. And these were male-dominated organizations and institutions focused on the council of elders and religious leaders. Women said, yes, men dominate formal gatherings and village leadership. They said they felt excluded from consultations about development interventions. They said we get invited to attend, but we're never included in the decision making. Men were often called for communal work, so that was a pattern for both village level and for external agency implemented projects, but women were not. So our cash for work went a little against the grain there. 3 villages had a women's charitable organization, religiously motivated, run by better off women, but a possible entry point for later activities. The focus groups also said that they were marginalized when they needed to access natural resources, and they always had to rely on men to negotiate for them. For example, when wells ran dry or there were issues around fodder. Next, please. So, key results from listening, from actually going out and consulting men and women separately, just in 6 villages. We found, as we anticipated, that men and women were both important contributors to the household economy. Both women and men's work was essential. And that within this sort of household economy of productive and domestic work, they either shared or they had complementary roles, but very important, and more important as they got poorer. Women had somewhat higher domestic and reproductive work burdens and less leisure time. We had men and women disagreeing about who did what. And I think this is critical. This is one of the most important reasons to listen to men and women separately. They will tell you different, they will give you different accounts. So, men would say, oh, we do all the water collection. Women would say, well, no, actually, we do quite a lot of the water collection because men do it this way and we have to do it this way. Firewood collection again, sometimes fodder collection. So you can't listen to one gender's account of what the other gender does because it has a bias, because they misrepresent quite often as to their own role and its importance. And it was clear that women felt excluded from consultations, including for humanitarian development interventions and community decision making. Next, please. So how did this gender analysis change how we approach resilience? We said, well, okay, we've got a degree of gender blindness at FAO. We're working with local partners. These are male dominated. They often work with, they always work with the male community leadership, and they focus on male-led agricultural activities. And we have gender gaps. We're limiting our evidence base by not talking to men and women separately and building up a picture overall. Next, please. So what were our entry points? And I'm going to talk firstly about FAO. we decided we had to change our processes. We had to disaggregate data. We need to know who does what, with what, where and when. You can't just talk about livelihoods or livestock or marketing or food security. You have to interrogate. And if you don't interrogate and if you don't disaggregate, you end up just talking about what men do. We had to consult women, which meant we had to ask our partners to employ women to talk to women. We had to train and undertake monitoring with women. We asked for separate programming based on women's agricultural activities, not just a percentage reserved for women, but separate programming. We pushed to include the poor and the ultra poor and to use new ways to identify the poorest, and also to analyze male and female spending patterns further. Quite difficult in the 2013 context, but as we moved along, we could do that better. And we wanted to nuance seasonal targeting to avoid work peaks like the fodder collection. Next. In terms of livelihood, I think we identified quite a range of areas where we could review and look for entry points: fodder, women's livestock, vegetable and fruit, sisal for crafts, how we did our cash for work, what accommodations we made, what we, how we designed locations, type of work, hours of work, businesses, where women are businesswomen, where can we support them on that? And where women are key mediators of informal social protection, informal social support, how could we support that, these milking goats? Finally, we said, do no harm. What we do has to be acceptable to the broader community because these are very strict communities, and if we go too fast, we will alienate, but we must look for entry points. Next. The resilience programming continued, and it was redesigned in 2015. It's become a joint program, so even more alignment and coordination, and a common results matrix, as well as shared beneficiary database. There's a big focus on food security with nutrition, which obviously takes us towards women's role in food security. And in the theory of change, there's a dedicated outcome to reducing women's work burden, to improving their community support on various issues, and to improving livelihood and other options, including access to services. And finally, taking off my FAO hat and putting on my Oxfam hat, I'd like to say that as the Global Humanitarian Team, we have recently developed a social protection strategy which is focused on integrating social protection with our humanitarian work and ultimately with our development work, because we have a foot in both camps as Oxfam, and that there's a very strong gender responsive theme running through this. So I look forward to sharing that with you as we go forward. So thank you very much, and looking forward to the discussion.
Thank you very much to all of our presenters. Those were fabulous presentations. We're running a little bit low on time, but if socialprotection.org will allow me, I hope we can have about 15 minutes. Hopefully you in the audience can stay with us for a little bit longer as we address some of the questions that came in. And again, thank you, Social Protection. I just got the message, we can extend it. But we've had 4 questions come in. We may not be able to get to all of them, but again, go to socialprotection.org, join the discussion online, and the questions that we cannot address live now will be answered there. So I am going to take myself off video feed, and I encourage the panelists to come back onto video feed so that this can be, if they can do it with their internet connections, so that this can be more of a panel, and I will start addressing the questions to them. Thank you to those of you who submitted these. So there's a question on here directed to Libby specifically, to Maria Libertad. This question is specifically about the context of the Philippines. So Libby, in the Philippines, our question asker, Barbara Laseni, writes, the new administration is not very keen on social protection, and there was a high turnover of those working in the 4Ps program. So how do we then ensure sustainability of social protection or shock responsive social protection when administrations change? So this could be the context of the Philippines, but elsewhere as well. How do we ensure buy-in from different administrations? And if you could answer that quickly, I can ask some questions to other panelists as well. Thank you. Libby, your audio is not on, I think.
Okay. Thank you for the question. Well, as a Filipino myself, what I can generally comment about the political context in the Philippines is it's about the behavior of our political leaders, which is very, very partisan. So if we look at the different programs of different administrations, they kind of recycle them to, what I mean is that they may stop a particular program which is good, but they would create something which is in most cases very similar, but they are just packaging them so that it will look as if it's their own program. And that has been happening. So what I see now is if the current administration will remove a particular pre-existing program because it's a program of previous administration, they would launch another one which is very similar. So that's a good in a way. But to answer the questions on sustainability, my thoughts are, one is really look for champions, for if they could be partisan or non-partisan champions, because they are the one who can convince decision makers on making sure that the same programs would continue, would be part of the priority of the administration. Second is to really have very good evidences, so that when we defend this and say we have to continue this, a particular agency in the government would say that based on evidence, this program works. You want a pro-poor program, this is what we have. This is proven by certain evidence. So, and then third is look at the policy environment. In what's good in the Philippines is that we have so many very good law and policies, and we can use them actually to demand accountability and say, but this has been already legislated that we have to have these particular programs. And talking of social protection in the Philippines, it's not just one program. Now, 4Ps is a very huge one, but when we go to the Department of Health, PhilHealth is a social protection program on health. Department of Agriculture, crop insurance, they have that. So these are dispersed. So we can work with different agencies and look at what's the available policies and laws that would support those programs. And my last point is, when I was talking in my presentation, integration is very important. We were talking of institutions here, we're talking of governance here, but those are not just the elements to make sure that social protection continues. So we have to ensure that women are there, beneficiaries are organized, they can lobby for that, and then all the other ingredients that we need so that we can really ask the government for a program that we want because it's a good program.
Thank you very much, and thank you for your quick response, because we have some great questions and additional questions coming in. I'm going to address the next question to Rebecca. Okay, so actually anyone could respond to this question if they'd like to. It came in after Rebecca's presentation, but this is from Maureen Loku. And it's really about the common pitfalls that need to be avoided. I think we heard from some through both the case studies and from Rebecca conceptually, but when designing a social protection program with a goal of women's empowerment, what are the key considerations and what are the common pitfalls? And I think because we've heard quite a bit on this as the presentations progressed, maybe just if one of you would like to answer with one or two things that may not be the most sort of obvious answer, but are really important in considering how not to fall in some of the pitfalls of reinforcing gender inequality when designing social protection in crisis. Thank you.
Hi, it's Rebecca here. Yeah, I can have a first go at addressing this. I mean, obviously, you know, as me, well, myself, but also the other panelists also discussed, and particularly in Julie's presentation as well. And the first thing that comes to mind is that just the lack of vulnerability, sort of poverty and vulnerability assessment and data from a gender perspective. I think that is an absolutely huge pitfall. And I think if you don't get that right, then it's very, very difficult to integrate gender at a later date, or to really, you know, make the case for integrating gender when you don't have the basic knowledge and data and statistics on men and women's different experiences, not only in terms of how they experience poverty and vulnerability, but obviously also how they can potentially respond, but also affected by crises as well. But I think there's something else that we haven't really discussed throughout the presentations, which is around political commitment and higher level commitment to integrating gender into social protection. And I mentioned it earlier in the presentation that, you know, I think addressing gender is ad hoc at the moment. It's very dependent on the type of program, on the context of the people working on the program. But I think in general, you know, there's a lot to be said for thinking through the political economy of gender, and also understanding that in every context, and figuring out ways to really harness political commitment to integrating gender into social protection. And I'll let anybody else respond after that. Thank you.
Thank you, Rebecca. I will jump in here because I think we are running out of time, but I want to let the audience know that we've received quite a few fabulous questions, so thank you. And we're going to start wrapping up, but if you're interested in reading the answers to some of these questions, please go on to the socialprotection.org platform on gender-sensitive social protection. Some of these questions involve, you know, how can men be more meaningfully included in gender-sensitive and gender-responsive approaches to social protection? What kinds of data can we collect beyond just sex and age disaggregated data? And hopefully all of these pique your interests and you can check them out online. I want to thank all of you for your time and for joining us today. We really appreciate you listening in, and I want to again thank our 3 panelists. So thank you all very much. Please also make sure to do the survey at the end.